In this lesson, we're going to talk about meningitis and its nursing implications. So, if we break down the word meningitis, then we can determine that it is itis, inflammation of the meninges. So, the meninges are the layers of tissue surrounding the brain. So, there's the pia mater on the very inside, then there's the arachnoid layer, and then there's the dura mater before the skull. So what you'll notice is that in this arachnoid layer, there's blood vessels and nerve endings in that layer. And so what happens is if you have bacteria in your bloodstream, it can possibly make its way into this part of the brain and it can infect these layers of tissue around the brain. Now, another risk factor is really any kind of skull fracture. We talked about this in the fractures lesson when we talked about the skull being like a peanut M&M. Right? So if you break the shell, you're going to expose the chocolate, which is the meninges and the CSF. And so that's going to put them at risk for any kind of infection. And then really anything that cuts into the skull, like a surgical procedure like an EVD or a craniotomy, all of those things can cause meningitis. So when we get infection in here, these layers get inflamed and they get swollen and they start to cause a lot of issues for the patient. Now, it is an infectious process, so we'll see patients having fevers from the infection itself, as well as they'll get some headaches from all of the just irritation around the meninges. And then quite often, they're going to have altered LOC. That can range anywhere from just confusion or drowsiness all the way to delirium, etc. Now, one of the classic signs of meningitis is nuchal rigidity. Now, this happens because of the inflammation in the meninges, and it causes the muscles in the neck to spasm. It makes it difficult, near impossible for them to actually bend their neck and touch their chin to their chest. Now, if you refer back to the adjunct neuroassessments lesson, then you will see my explanation of the Koenigs and Brzezinski sign, which were signs and hallmarks of this nuchal rigidity. Now, patients could also be lethargic. They could be photosensitive, which means that they have a sensitivity to bright lights, especially in their eyes. Makes it painful to actually look at the bright lights. And then, of course, because we're seeing swelling around the meninges, we have the risk for the increase in intracranial pressure. As meningitis progresses and causes more and more irritation within those nerve endings and within the brain, we also have a risk for seizures. So we need to make sure we're protecting these patients. Now, when you think of meningitis, I want you to picture Edgar from the movie Men in Black. His body was taken over by an alien bug. He became stiff, pale, he looked like death, and he just wasn't himself anymore. So patients with meningitis, they've had their nervous system taken over by a bug, a virus, bacteria, etc. And honestly, patients even describe just feeling like death, and they're stiff and pale, and they just look awful, and they're confused, and they're not themselves, okay? So anytime you think meningitis, I want you to think Edgar from Men in Black. So to diagnose meningitis, once we have this suspicious clinical picture where we're pretty sure that's what's going on, we're going to do a lumbar puncture to analyze the CSF. We stick a needle into the subdural layer around the spinal cord, and we'll draw out some CSF and we'll test it for bacteria. We'll also just look at it. If it's cloudy, that might be indicative of infection. We'll see white blood cells within it because they're trying to fight the infection. And then we'll actually see decreased blood glucose because bacteria consume glucose. They eat it. And it's so funny to go back to the Edgar analogy because even Edgar was craving sugar water. So always think Edgar when you think meningitis. Now, big important detail here is that meningitis is transmitted by droplet. And so we always need to put these patients in droplet precautions as soon as possible. This is mask, gown, and gloves. And so the droplets are going to be all over everything. We want to make sure that we're cleaning things very, very well and very thoroughly. And then the other thing that makes meningitis at a high risk is being in overcrowded or overpopulated areas. Good examples are prisons and homeless shelters. And then even college dorms. There's a lot of people living in a small space, and it definitely puts you at risk for meningitis. Some colleges even require for you to get the meningitis vaccine to be able to come. Now, the other thing to consider is that we want to prevent it from spreading out in the community. And honestly, the best way to do that is hand hygiene. Wash your hands, stay away from people who are sick, and protect yourself that way. So managing meningitis obviously depends on the source. If you remember from the blood-brain barrier lesson, We discussed that antibiotics for bacterial infections are often unable to cross the blood-brain barrier. And so a lot of times, all we can really do for patients with bacterial meningitis is supportive care. So that's why you'll hear people say that bacterial is worse than viral. And so either way, we're going to do our best to fight the infection. We're going to manage the symptoms, and we're going to work to prevent further transmission both to other patients within the hospital as well as out in the community. So like I said before, we're going to put the patient in droplet isolation, droplet precautions. We're going to give them analgesics and antipyretics to take care of their pain and their fever. And we're going to give them any antimicrobials that we can, antivirals if it's appropriate. Again, we've sampled that CSF. We can culture it. We can determine what the organism is and make sure that we treat it appropriately. So our priority nursing concepts for a patient with meningitis are infection control, cognition, and safety. We're going to give those antimicrobials, and we're going to prevent transmission. We're going to assess their LOC. And of course, we want to keep them safe. We're going to put them on seizure precautions and prevent them from injury. Make sure you check out the care plan attached to this lesson for detailed nursing interventions and rationales. So let's recap quickly. Meningitis is an inflammation of the meninges of the brain due to some sort of infection, either bacterial, viral, fungal, or even protozoan. We'll use a lumbar puncture to analyze the CSF to confirm our diagnosis. Based on our clinical suspicions, we will have seen those symptoms. Classic symptoms are fever. A lot of times they'll have a headache, altered level of consciousness, and that classic nuchal rigidity that we see. We want to put the patient in droplet precautions, and we also want to protect them and keep them safe and put them on seizure precautions. Remember, that includes things like padding the side rails and giving those anti-epileptic medications. Remember, in Module 3 of the respiratory course, we did talk about droplet precautions. So if you want to go back and review that, you can. And then we talked about seizure precautions in the Module 5, the seizure module of the neuro course. So check that out as well. And then, of course, remember our priorities of care are to fight the infection, manage the symptoms, and of course, prevent any further transmission. So that's meningitis, and that wraps up the neuro course. Don't hesitate to contact us if you have any questions. Now go out and be your best selves today. And as always, happy nursing.